Hello, everyone. We're going to get started here in just a few moments. Good afternoon, everyone. Thank you all for joining us. My name is Ashley, and I want to welcome you to our first all-staff virtual forum, How HealthRIGHT 360 is Addressing Racism, a Public Health Crisis, brought to you by the iDARE Steering Committee. Moderating this forum will be our Vice President of Human Resources, Neelab Nawabi. Participating in this panel discussion will be all members of our iDARE committee. Before we begin, I'd like to briefly go over some housekeeping guidelines. All attendees are muted during this virtual forum, so if you have any questions that you would like the committee to answer, please be sure to type them in the Q&A feature. If you're experiencing any technical issues, please notify us in the chat. Again, please submit your questions using the Q&A feature. You can start to submit your questions to the Q&A feature at any time during the forum. The committee will answer as many questions as possible during the Q&A segment. You do not need to wait to start submitting your questions, so please feel free to submit them at any time. In order to maintain a safe space, we would also like to ask everyone to please be respectful and appropriate when submitting comments or questions in the Q&A. And with that, I'll hand it over to Neelab.
Thank you very much, Ashley. Good afternoon, HealthRIGHT 360ers. Thank you for joining us today for this all-staff virtual forum presented by the iDARE Steering Committee. I am Neelab Nawabi, your Vice President of Human Resources, and I'm extremely proud to be the moderator for this discussion today, How HealthRIGHT 360 is Addressing Racism, a Public Health Crisis. As you may already know, HealthRIGHT 360's legacy dates back to 1967, when we stepped up to support thousands of people in need by providing free and essential healthcare services to people from all walks of life, regardless of their background, age, income, sexual orientation, and race. Since then, we've worked under a simple yet powerful framework. Healthcare is a right, not a privilege. This last year has tested each and every one of us beyond measure. Yet we all stepped up to pivot, adapt, and meet the needs of our clients and communities throughout the COVID-19 pandemic and continue to provide integrated healthcare services to all who came to us for care. We never shut our doors. We never stopped supporting our clients. We never stopped driving our mission forward, despite this deadly public health crisis that has taken over 500,000 lives in the United States alone. However, the COVID-19 pandemic is not the only public health crisis that has taken lives from people and communities. It's not the only crisis that's left people in isolation and despair and has caused and continues to cause collective trauma and grief. It's not the only crisis that requires time, care, dialogue, and strategic action to be addressed. Racism is a public health crisis, and it's not a novel one. It's a public health crisis that's devastated BIPOC, which is an acronym for Black, Indigenous, and People of Color communities for centuries. Racism disproportionately shapes the environment and life experiences of our staff and the people that we serve every day. Racism adversely influences our clients' risk of developing addiction and their access to evidence-based addiction treatment services and primary care services. While this last year has highlighted the deadly consequences of racism, it's also illuminated the systemic racism that's built into the fabric of the United States. Today, our iDARE committee will formally introduce themselves on this virtual platform, and they'll also share the work that they've been doing as it relates to strategic action against racism to enhance HealthRIGHT 360's efforts to identify, disrupt, and condemn racism throughout our family of programs. I am excited to introduce our panelists, the iDARE Steering Committee, who will provide a framework for understanding racism as a public health crisis and how HealthRIGHT 360 is addressing it. And now I want to present to you the iDARE Steering Committee members. I'm going to take a moment to read each committee member's name and title, and we're going to go by alphabetical order. First is Dr. Ana Valdez, our Chief Healthcare Officer and one of the executive sponsors of the iDARE Steering Committee. Bree Isaguirre, who is the Executive Assistant to the CEO. Denise Williams, the Vice President of Corporate Compliance, Katie McCall, Director of Human Resources and Benefits, Maribel Baez, the Vice President of Medical Services, Michelle Rosemond, Managing Director of Prevention and Domestic Violence Programs, Rashida Black, our LPHA Program Manager from North County Serenity House, Roselle Buenavista, Managing Director for Santa Clara County and Alameda County, Regina Brown, Managing Director of Transportation and Warehouses, Tracy Bracey, Program Director for FOTEP El Monte, and Vika Eisen, our President and CEO and the other executive sponsor for our iDARE Steering Committee. I want to thank our iDARE Steering Committee and panelists for putting this forum together, as well as Ashley and Alex for assisting. We're going to have the opportunity to engage in a live Q&A session with the iDARE Steering Committee members at the end of this forum. Please make sure that you use the Q&A function to actually type in your questions so that we can receive them. And now to kind of start off our discussion, I'd like to welcome our first speakers to the virtual stage, Dr. Vika Eisen and Dr. Ana Valdez. Vika and Ana, you are both the executive sponsors of the iDARE committee. Vika, can you talk a little bit about why the iDARE steering committee was formed?
Sure thing. Welcome everybody, and thanks for joining us today. So I want to start off by saying I've always viewed the work that we do within a social context. That means that our clients and our staff live in a world that's affected, in communities that are affected by economic injustice, by white supremacy, racism, gender inequities. So we bring that to our work. We live in the web of all of those challenges, and we cannot afford not to address them, because with our clients and for our clients, because that is part of how we help support them on a path to help. And how we address that, I think, is what we want to talk about today. So different pockets of the organization have done time of our existence and in all of our family of programs. And of course, we're all required to file class plans, which are cultural responsivity plans with our county funders. But those efforts don't at all rise to the level of commitment that I think is really required of us as an organization. The events of last year, including the subsequent rising in national protests against the murders of George Floyd and Breonna Taylor, among others, by police, made clear that the time was past due for HealthRIGht 360 to be actively and comprehensively engaged in addressing issues of systemic racism across the entire organization and in everything we do. Like, I would believe this to be true, even if we were an arts organization or maybe a financial services nonprofit, but it is ever more true because of the nature of the work that we do. We work with the victims of the racist policy that is the war on drugs. And sometimes our work puts us in a position where we have to question our complicity in those failed policies. So Ana and I agreed that we could not wait until the pandemic was behind us to get started. And the time is now. Ana and I spent, we continued to come in last year. We carpooled together when the world shut down. So we had ample time and carpools in our cars to talk about our thoughts and our feelings about this. Ana, is there anything you want to add about the kind of the inception and the birth of this process?
No, I think you really captured it all. It's been a difficult year in so many ways. And sometimes you look at that and you think, why do this work when things are already hard? But it's also the call at that time to really do the work. So yeah, I'm excited that it's moved forward despite all the other things we've had to focus on with the pandemic. So definitely now is the time and the momentum.
Absolutely.
Thank you, Victor and Ana, for that detailed answer. Ana, this next question is for you. In April of 2021, the Center for Disease Control and Prevention declared racism to be a serious threat to public health. As our Chief Healthcare Officer and doer of everything, can you talk about the significance of this declaration and how it relates to what we do here at HealthRIGht 360?
Absolutely. Thanks, Nilab. It is incredibly super significant because it signals an awakening. It's an awakening to health disparities that have been going on for a very, very long time. They're not brand new. And I think it really was spotlighted in this past year with COVID. COVID really took all those health disparities that have been there, that we recognized, that were frustrated about something to do, and brought them to the forefront so everybody could see them, and really emphasize the impact on communities of color by this disease. I think the statement by the CDC is also impactful because it talks about social determinants of health. It doesn't just talk about chronic conditions like diabetes and high blood pressure and things like that, but also the social and systemic things that affect health and that are very important to having good health. So super significant. It's a nationwide organization calling attention to the impact of race and other forms of discrimination, including gender and sexual identity, to really the impacts of health that we see in the communities that we serve. That's how it absolutely relates to the work we do, because these are the communities that we're working with. We're working in the safety net. We are essential to them. They don't always have access to care, and they don't always have access to high quality care. And so it's essential that we do this work. We often think of it as public health work, but the truth is it's all of our work. So I really laud the CDC for this statement. It kind of snowballed into other organizations, medical and otherwise, saying, hey, yeah, we need to really look at this and look at the data that's been there for years. So it's significant, and it definitely relates to the work that we do.
Thank you, Anna. And to kind of build on that, you had mentioned that there's a lot of data or information that kind of shows that racism is built into the system. What would you say to people who argue that racism is not a factor in adverse health conditions, or rather that it's not something that's built into the system, it's just how it is? What would you say to those types of folks?
Yeah, I mean, I think, again, the significant part of looking at this work is looking at the social determinants, because those are oftentimes dictated by the systems that we built, and that the proof is in the data. I won't throw a lot of data at folks because nobody is that excited at looking at a lot of numbers unless you're a data geek, but really, let's start with COVID, which we are still kind of trying to get through. Lots of increased cases of hospitalization, cases of COVID, and deaths, and very clearly shown to disproportionately impact American Indian and Alaska Native populations, as well as Hispanic and Black populations. For a long time, we've had data that shows that the life expectancy for people of color is less than those for people who are white, especially Black people, and especially for Black men. Studies have also actually been done and shown that the quality of care is impacted by the biases that we as providers bring. And often those biases are against people of color, people who are non-binary and have different gender and sexual identities. And so people don't get as high quality care as they would otherwise. And so I think it's borne out in the data. And I think it's clear that the data isn't just about kind of the biases and the medical practices, but also just how the system impacts that. When we deny people, when we push them into areas, and I know my colleagues will talk more about this, of poverty and disadvantage, then that also bleeds over into their health.
Thank you, Anna. Vicki, this next question is for you. What's your vision for HealthRIGHT 360's fight against racism and discrimination? And what does an anti-racist HealthRIGHT 360 look like to you?
I envision an organization that puts equity and justice at the center of our work. That means we look at issues of equity and justice across the entire organization, from what kind of services we give, what interventions we select, what's our client's experience, staff experience, hiring, training, development, disciplinary practices, and also our advocacy efforts. It's the work that we do to make change around us for our clients and for our staff. I know that HealthRIGHT 360 alone cannot end white supremacy and gender oppression. That does not relieve us from the responsibility of trying to create a country where the people we serve and the people who work here survive and thrive.
You mentioned right now equity. What to you is the difference between equality and equity?
Oh, there was some really great like infographics that came out around this, and it showed like equality is God, I can't remember the infographics, but equality means everybody is treated equally, but that is not always fair. That doesn't mean fair. If I have kids, I explain this to my kids because different people need different things. So equity is really about a proactive engagement in bringing justice and fairness. That isn't the same as treating everybody the same. It's about really treating people to make sure that people who, because of issues of race or gender, have been denied opportunities, have been denied healthcare, that they are placed in the forefront to redress some of the pains and ills that are caused by that. So that's equity.
Vitka, are you thinking of the infographic of the people standing trying to look over the fence?
Yes, I am.
Equality is they all have the same size box. So the little kid or the shorter person, like myself, can't see over the fence. But equity is that the boxes are of different sizes. So we're all raised up together so we can look over the fence.
Thank you. That is exactly the infographic. And I was going to get all messed up about the size of the boxes. I wasn't sure if it was a ladder or not. So,
well, great. Anyway. Thank you both for that answer. And now, Vika, I'm going to hand it over to you so you can go ahead and start talking about some information about addressing racism and helping our staff and clients get better, do better, and be better.
Thanks. And I want to talk about the drug war because I think, as I said earlier, our work is uniquely involved in issues of race as a result of the war on drugs and how clients came to us for care. So I want to welcome Regina Brown to the virtual stage. We've had some, Regina and I have had some great conversations about this, and Regina's going to talk a little bit more about the war on drugs and its impact on Black and Brown communities.
Thank you so much, Vitka. Yes, as you can see by the slide here, I will not be reading the slide, but definitely I will be discussing what we currently have today. So thank you so much for that introduction, Vitka. So again, once again, my name is Regina Brown, and racism is not an unfamiliar topic for any of us. Throughout U.S. history, there have been many examples of extreme racism, such as the enslavement of African people, Jim Crow, segregation, and the bombing of Tulsa, Oklahoma, internment camps, lynching, and church burnings. Today, racism is not as blatant, but it is still very much alive and hides within our laws. The type of racism is called systemic racism. It is a racism that results from the inherent biases and prejudices of the policies and practices of social and political organizations, groups, or institutions. We see it in the criminalization of drugs, which gave way to the establishment of unfair sentencing laws of Black and Brown people. We see it in our schools, stemming back to redlining and racial zoning, which is in part predetermines your economic status and reduces equity, which also fuels the school, which also fuels school to prison pipeline. Another technique or tool is racism commonly used is dehumanization, the creation of the other or otherness. This technique is used to deprive a people or group of positive human qualities. It has been used to justify wars, judicial and extrajudicial killings, slavery, the confiscation of property, denial of suffrage, and other rights. In the late 1800s, the first drug law was established with racist origins under the disguise of an anti-opium ordinance. Opium smoking was associated with Chinese immigrants who were discriminated against both institutionally and Chinese immigrants by banning the smoking of opium. The same law was the foundation for the prohibition of cocaine, powder versus crack. Crack specifically is considered a drug more commonly used by Black people. In June of 1971, President Nixon declared a war on drugs. He dramatically increased the size and presence of federal drug control agencies and pushed through measures such as mandatory sentencing and no-knock warrants. So that's where we get those from today. These laws impacted Black communities at a higher rate than other communities. The war against Black people and other persons of color continued under President Bill Clinton, who had the largest increase in federal and state prison inmates of any president in American history. The war on drugs has produced profoundly unequal outcomes across racial groups. We see this manifested through racial discrimination by law enforcement and disproportionate drug war misery suffered by communities of color. Many different communities of color bear the impact of the discriminatory enforcement of drug laws. This impact may vary across cities and regions, but nationwide, some of the most egregious racial disparities can be seen in the case of Black and Latinx people. Higher arrest and incarceration rates for these communities are not effective of increased prevalence of drug use, but rather of law enforcement's focus on urban areas, low-income communities, and communities of color. Disparities in arrest and incarceration are seen for both drug possession, law violations, as well as low-level sales. Those selling small amounts of drugs to support their own drug use may go to jail for decades. When we think about HealthRIGHT 360 and how the war on drug and systemic racism relates to the work we do, we must think about our relationship with the drug courts. In a way, our program depends on the racist system in which we object to. Systemic racism via the war on drugs help create the population we serve and ensure that we always have clients to serve. This is not to imply that drug use would end if systemic racism ended, but just to say that we are a part of the problem as well as part of the solution for the majority of the clients we serve. Hopefully, as our country continues to change, its policies and disproportionate impacts on Black people and other persons of color, programs like ours will increase the number of voluntary clients and reduce its dependency on the system we hope to change for the better. I now turn it back over to you, Vika, and thank you for this opportunity.
Thanks, Regina. I think the point you brought up about the drug courts is really important. And I know many of our staff have talked with clients, and clients will say, drug court is what got them into treatment, the drug court saved their life. And we don't intend to invalidate their experience of that. At the same time, overall, research has found that drug courts overall has resulted in more people being criminalized for their drug use. So in the end, although it's helped some people, as a system and a process, it has not. Mass incarceration, the drug laws leading to mass incarceration of Black and brown people, has had a multiplier trauma effect on communities because it harms families and communities beyond the life of the individual incarcerated. Additionally, in terms of violence and police murders of Black and brown people, you can draw a direct line from the direct declaration of the war on drugs in the 1970s to the murders of George Floyd and Breonna Taylor. If you recall, those of you who watched the horrific video of George Floyd's murder, one of the police officers turned to the folks who were doing the videotape and said, "See, don't do drugs, kids," as if that justified that man's death. And Derek Chauvin's attorney tried to blame George Floyd's death on his use of fentanyl. In other words, his life was less valuable because he had used drugs. And Breonna Taylor fell victim to a no-knock drug warrant served by a highly militarized police force. And finally, as Regina said, we really have to take a long, hard look at the work that we do with people who use drugs. It forces us to think about our own relationship with the criminal justice system and what would really serve our clients best. So this is kind of the foundation and the underpinnings of the steering committee. But of course, we have a broader commitment to the organization, a broad commitment to the organization. So I want to go on and have the committee introduce itself, talk a little bit about, so we'll bring the rest of the committee members on to talk about iDARE and how we came about and even our name.
Thank you, Vika. And hello, everyone. This is Bree Isaguirre speaking right now. Before we give an overview about the work the committee has been doing, we do want to take the time to share our iDARE values. This serves as the committee's North Star and provides a framework for what we're doing in iDARE and throughout our organization. The first value is inclusion. We actually like to summarize the intent of that value with the saying, quote, "Nothing about us without us," unquote. For iDARE, inclusion is about valuing strategic inclusion of our community, our stakeholders, to make informed decisions that impact our staff and the people that we serve. It's also about creating equitable opportunity for people to show up and have a positive impact on our HealthRIGht 360 community, again, our staff and the people that we serve, in a meaningful and lasting way. As an organization and as a committee, we know that we have to have different policies and practices in place in order to create a genuinely inclusive space. And that is something the committee has been working on over the last year, and something we're going to continue to be working on. But we'll get more into detail on that later. And I'll hand it over to committee member Tracy now.
Thank you. Thank you, Bree, and welcome everyone. Thank you so much for showing up, for logging in. You know, it's really an exciting time for HealthRIGht 360 approaching this issue that affects us all. As Bree was talking about, our iDARE values that we have come up with as a committee, you know, took a lot of thought and process and agreement, you know, that these are the things and this is how we're defining them to send them to our fellow colleagues out across HealthRIGht 360. So, you know, this is a launch of this committee, and then you guys that have shown up and are coming into HealthRIGht, onboarding, you can say, hey, I was there when it started. And so you're able to pass it on, and it's part of your historical story when you start telling your clients, your coworkers, how it was, when it came, you know, with this thing that we're doing right now to address this need, this public health crisis. Diversity is a big one for our iDARE values, inclusion, anti-racism, equity. These things all go together. We're committed to that diversity of culture and experience and thought of all, where acceptance and contribution are not determined by race, class, gender, ability, sexual orientation, faith. Because what makes you so great is when you have this melting pot of people, because different people bring different ideas, different perspectives. We learn so much from one another when you have people within that organization that is committed to the work that we do. You know, I really appreciate you guys being here today. Thank you, Bree. And I want to turn it over to Razel now. She's going to talk further.
Hi, everybody. My name is Razel Buenavista. I'm the Managing Director for Santa Clara County and Alameda County. The A and the R in the acronym iDARE stands for anti-racism. And whenever someone is doing diversity, equity, and inclusion work, there's an understanding that racism must be part of the discussion. The iDARE committee set forth an intention to specifically call out anti-racism as part of our name and our mission and our values of the iDARE committee. So as listed in front of you, the AR, or anti-racism, means our commitment to taking action against racism and the systemic oppression of marginalized communities. Okay, and I will turn it over to Denise.
Thank you, Razel. So the next value is equity. We are committed to equitable treatment and elimination of discrimination in all its forms at all organizational levels and throughout all programs. The term equity refers to fairness and justice and is distinguished from equality. I think this is also, I want to add what Vika was alluding to earlier. Whereas equality means providing the same to all, equity means recognizing that we do not all start from the same place and must acknowledge and make adjustments to imbalances. The process is ongoing, requiring us to identify and overcome intentional and unintentional barriers arising from bias or systemic structures. I will now turn it over to Michelle Roseman, who will go further in the iDARE purpose, vision, and scope. Thank you.
Hello, everyone. My name is Michelle Rosemond, and I will talk about our purpose. I want to let everyone know that the iDARE committee met over several sessions with great discussion and really courageous dialogue to outline our charter. And our charter is really our marching orders. It's our outline of what we're going to do and how we're going to do it. And in that charter, it identifies our purpose, our vision, our scope, and our values, which you just heard. And each part of our scope, purpose, vision, and values was really intentional. It was really meaningful. And so I'll go through it here. So our purpose, the purpose of the iDARE Steering Committee, is dedicated to providing leadership, taking action, and holding the organization accountable to build an environment that is anti-racist, diverse, inclusive, safe, and equitable in culture and practice in all aspects of our work. Our vision is to eliminate discrimination and intentionally create a culture at HealthRIGHT 360 where diversity, equity, and inclusion are respected and valued. And then our scope. Our committee is guiding the fulfillment of inclusive, diverse, anti-racist, and equitable activities, duties, and responsibilities throughout HealthRIGHT 360, from the board of directors to leadership to all staff and even the clients and the participants that we serve. So this is our purpose, vision, and scope. And this work is broad, it's significant, it's all-encompassing. And so an important part of our work was then to identify areas of focus. And so what we did was we created 3 work groups. And those work groups include policy and procedures, evaluation, and communication. And so now I will hand it over to Dr. Valdez, who will speak on our first work group.
Hello, everybody. So I am the lead for our policy and procedure work group, and our first area to address was incidents. You can see the purpose of the incidents here. It's establishing protocols around occurrences of racism for both clients and employees, formalizing an action plan that gets us to a place of growth and restitution, and tracking areas of concern so that we can look again at the data and see what it's telling us and address those issues. Our group consists of not only members of the steering committee, but also content experts from the organization. Our group met with members of the compliance group, which is working on a new incident reporting system. And we were able to make recommendations and give input into a new incident reporting system area specifically to prejudice. We are working on this part and also getting to making recommendations and giving input on training, not only on training for when and how to file these incidents, but also training and support for staff and clients about how to deal with these issues in real time. I do think one of the things I want to emphasize is that I think there's a little confusion about incident reports and when do we file them, et cetera. Incident reports can be used in a broader way, and they are used when you have an issue with another staff person or a client or things like that, even if it's verbal or anything that's kind of related to some kind of prejudice against you. So just want to clarify that. And next, I'm going to turn it over to Bree, who's going to talk about communication.
Hi again, everybody. So I am super excited to be giving you an overview on what the iDARE communications work group has been working on. Overall, this work group will perform the activities needed to plan the ongoing communication of iDARE progress and highlights, and develop a communication plan, format, timeline, and audience for iDARE messaging, both internal and external. One of those initiatives is the iDARE newsletter. We are very excited to announce that we are currently working on the first ever iDARE newsletter. that will be released on the week of Juneteenth, so coming up next month. And the newsletters will include content like local and national calls to action, online DEI resources, updates from the chairs and subcommittees, and we will also highlight programs and staff that have been doing iDARE work at their sites, and also highlight those programs that have been doing iDARE work before the establishment of the committee. Like Vika mentioned earlier, the pockets of the organization. Our other big project is the iDARE virtual forum that you are all experiencing right now. This forum today is the first of a series we are piloting this year. And we plan on using this format to give staff live updates on the work of the committee, use this virtual platform to engage in thought-provoking conversations that support iDARE work throughout our organization. Yeah, as we carry on this mission. I'm going to hand it over to Vika now to take over the next slide.
Thanks, Bree. So one of the kind of basic elements that we wanted to do up front is to do a survey to gather some information about staff experience of the organization, but also through staff's eyes, client experience of the organization, and also to gather information from clients. So, you know, one of the things that we do with clients on a regular basis is we do client satisfaction surveys. And I will tell you that the area that is consistently marked lowest, and this is for years, has been in the question in the survey that says the staff is sensitive and responsive to my culture. And so that is an area that never has hit our threshold. And so we already know that we have a lot of work to do for our clients to feel like they are honored and valued and safe in the program based on race or ethnicity or gender identity. So we want to send out a survey, and you'll hear more about that in a minute. So we want to gather some information. We want to receive feedback from all levels, frontline staff, like I said, from clients, from our board. And then this will help us kind of hone in on a work plan and determine areas of the greatest need. There's a lot of work to do in an organization of our size and scope and geography. And so this will help us give some framework to what to prioritize. It'll also help us establish a baseline so we can look at some of these things a year down the road to see, have the interventions that we've attempted, have the changes we've made a difference for our staff. And so that's the work of the evaluation group. I'm going to turn it over now to Maribel, who will talk a little bit more about that survey coming out and a call to action.
Hey, thank you, Vika. Yes, so call to action for all of us. These slides and this presentation, I think, will be available to all of the staff. And so what we're really asking everyone to do is to please complete the survey. This, like Vika said, will give us foundational data. What we have come to kind of really, not realize, but actualize this year is that the onus is on us, right? We need to learn how to be comfortable talking about racism and systems of oppression. And we're hoping that through this infrastructure and this evaluation of our organization, through the facilitation and support from you all program-wise and from the support of iDARE, that we can help you all have healthy discussions with your staff on how we contribute or can make change for both our clients and for our staff, excuse me, at HealthRIGHT 360. And so part of that comes with, like actual quantifiable data so that we can see that the changes proposed or the initiatives proposed by either program or iDARE as an organizational level has impact. And so it is so important, please, we would love some foundational work. We're going to send out an email with the survey and some keynotes on how to speak to your staff, how to think about this, and kind of in what mindset you're going to be thinking about this when you're completing the survey. And we would love to see high participation. So more to come from us on that. And I'll pass it on to Rashida to close us out.
Thanks, Maribel. My name is Rashida Black, and I will read the birdcage analogy. Consider a bird cage. If you look very closely at just one wire in the cage, you cannot see the other wires. If your conception of what is before you is determined by this myopic focus, you could look at that one wire up and down the length of it and be unable to see why a bird would not just fly around the wire anytime it wanted to go somewhere. It is only when you step back, you can see that the bird is surrounded by a network of systematically related barriers, no one of which would be the least hindrance to its flight, but which, by their relations to each other, are as confining as the solid walls of a dungeon. The philosopher and theorist Marilyn Frye wrote this analogy in 1983 to illustrate the unrecognized and misunderstood systems that create and uphold varying forms of oppression. Just want to invite all of you to reflect on this invisible, complex, and paralyzing system to contextualize today's information about structural racism. And now I will hand it over to Nilab for your questions and answers.
Thank you very much, Rashida. As Ashley had mentioned before, please make sure that if you have a question for the iDARE committee, to use the Q&A function and feature to write out your question. We have a couple of really good ones. We're going to definitely try to get through all of your questions, but if we are unable to get through your questions, we will make sure to put out a Q&A with anything that we didn't get to. And so with that, I'm going to go ahead and start with a couple of the questions. This first question is for Dr. Anna. Dr. Anna, how can a staff member join the iDARE committee?
That's a great question and very timely. So the iDARE steering, first of all, the iDARE steering committee is just the beginning, and we do happen to have some openings. We have had some staff who've had to leave the committee. So if you are interested, reach out to me directly. There is a questionnaire that I will send you because we're really looking for people who are not afraid to do the work, who will participate. It does take rolling up your sleeves a little bit, or maybe a lot, I should say. So you've got your job, but also doing some of this work as well. And it's not easy work, but it is incredibly satisfying work. So definitely reach out to me. I also wanted to mention that it has always been the vision when we started this, that it would not just be a steering committee at one level, that the steering committee would kind of be the oversight, but we would have regional program level work being done through committees, et cetera. And so some of what we hope to do over the next year is start looking at how that kind of rolls out at different levels. So it's not just sitting with the steering committee.
Great, thanks, Dr. Anna. This next question is for Rashida. Rashida, what would you say to staff who may be listening and don't believe that racism is a serious issue, as it may not affect them?
Well, that's interesting. I think, well, it's going to be a question about how this affects them. It affects everybody in such a different way. From my perspective, I'm a mental health clinician. I see the effects of racism psychologically. We already know that discrimination, aggression, injustice, prejudice, stereotypes, and direct and indirect violence and chronic and generational traumas contribute to higher adverse childhood experiences and poor adult mental health outcomes. But when it comes to inequality, when that inequality includes race, people of color often bear the burden of proof for overt and systemic bigotry. And it's common for people of color to experience and internalize various negative beliefs and attitudes that contribute to feeling unsafe, unwelcome, unwanted, and unworthy in mixed race spaces. I think stigma and judgment for our visible and melanated differences leaves an imprint. And many communities, luckily, families, tribes, they confront a lot of these negative images with shared values and traditions and storytelling, and spiritual practices, and other culturally relevant strategies that remind us about our resilience and positivity to refute that racialization. But I think, maybe in the absence of or in tandem with a lot of these cultural ideas, everyone in this webinar has a role in affecting the mental health outcomes in our respective environments. And that includes for our coworkers and for our participants. As providers, when we don't apply a cultural lens to mental health assessments and other evaluative tools, participants identify with really shaming pathologies based on illegitimate criteria, which makes it permissible to dismiss systemic experiences as personal failings. I think this is really true for people of color who exhibit behaviors that demonstrate the absorption of responsibility for historic power imbalances. The effects of internalizing racism include voicelessness and feelings of invisibility. It shows up as self-blame and depression, anxiety, paranoia, poor self-image. I mean, it could go on, right? Suicidality, truancy, relapse, emotional avoidance, an inability to express vulnerability. I think people of color also overcompensate for these perceived weaknesses and inadequacies. And sometimes in our staff, it shows up as poor self-care and unhealthy boundaries. So, I mean, it's kind of a loaded topic. All of this just to say that I think it's important for everyone, but especially for providers to show, well, to ask really how people of color experience race and racism, how this shapes their beliefs, to gain a better understanding of individual perspectives and perceptions and motivations, so that we can minimize and manage the psychological stress of racism. I think providers can help participants to find less harmful ways to cope that work for them by coming alongside. This is one of the reasons that iDARE was founded, so that we could join each other and challenge sources and causes of racism. So I think, you know, just acknowledging those occurrences, the effects of racism, working together to confront that oppression, it really helps to improve individual and community mental health. So whew, that was long-winded. I apologize. I'm so passionate about this work. So thank you for that question, Nalab. I appreciate it.
That was a great response. Thank you, Rashida.
Rashida, that was a wonderful response. Mila, can I add something to that?
Yes, please.
Okay. That was a wonderful response, Rashida. I want to talk a little bit about my work. I used to work for Walden House at the time in the state prison, in men's state prison. I ran the treatment program that was at the SATF at Corcoran. And if those of you who have worked in the prisons or any familiarity with California prisons, you know that they are very strictly racially segregated, and that there's a lot of violence that is always, in particularly men's prisons, like always on the edge of violence due to race. Back in the 1970s, that was something you should know about the prison population. It is way disproportionately Black and brown, but it is unanimously poor. Rich people tend not to go to state prison. Okay, unanimously, they're all poor people for the most part who end up going to prison. So back in the 70s, California inmates organized. They formed a prisoners union, and it's kind of as part of like the radicalization of people, and they joined together across races. It did not, this strict racial segregation in prisons didn't exist forever in the California prisons. So, white men and men of color united against a system that was oppressive to them. That united group force is pretty powerful and pretty threatening to the system. And so in supporting racial strife in the prisons, it made it so that the inmates could never really join together because they were too busy fighting each other. And that became its own self-perpetuating way of people keeping each other in themselves from uniting against an oppressive system. And it was I knew this story, but it was a white inmate who told me this. He was like, I'm going to come into prison, forever. And they didn't used to be like this. It was not like this. We all joined together to fight, to fight the cops because, they were kicking our butts. And sorry for swearing. And so the system of racism and white supremacy harms, we all live in it. None of us can escape it. We don't escape it. We don't live outside of it. And in the end, it keeps people from uniting against injustice in general. So just a final thought. Another thought I wanted to add to that.
Thank you, Vika. And this next question, we've gotten a couple questions around kind of the same topic. So I'm going to paraphrase a little bit. and it is for Maribel. What is the committee and the organization doing to identify issues of prejudice, and what are we doing to address them?
Yeah, that's a great question. So when the committee first came together, one of the topics was, how do we evaluate this, right? It's really hard to evaluate it when we're not calling it out explicitly, or we don't have the platform or foundation to really quantify that or report that. And so, yeah, it's a great question, is like, what is the experience of HealthRIGHT 360 employees or even clients or patients or with racism? The reality is that we can't really tell you. What we know is from anecdotal data and our experiences in our leadership teams, or even y'all in frontline staff positions who've experienced nuances or, experiences of racism, whether it be from a client to a staff member, patient to a staff member to a staff member, a visitor. And so we know that it happens. And so really for us, it's about creating an infrastructure through incident reporting, through the evaluations team, and to increase our communication to really document and really get some trend data, some evaluation data on how we can improve that. That can, as an example, I don't want to get too far into this, but as an example, could shift our onboarding process and really explicitly call out our anti-racist stance. We can emphasize this more in our mission. We can do more onboarding training, for our staff and where we stand. We're going through a cultural shift, and there is no going back. We are 100%, explicit and committed to being an anti-racist organization. We are not going to, I don't think we've ever hid from that, but we are going to call it out directly. And so unafraid. And that goes to our funders, to our vendors, to everybody that, like Vitka and Anna mentioned previously. And so, you have our commitment on that. And so how we analyze that data is on you all, so help us get that. And then we're always open to feedback as a committee to see how we can improve our practices and really kind of thread that through the network or, our organization.
Thank you, Maribel. I really appreciate the answer. And so this is also a similar question. I've gotten it a couple of times, and I'm going to kind of paraphrase it. Katie, this question is for you, which is, what are some things that non-BIPOC staff can do to support the committee and the organization's anti-racist work?
That is a great question. And I think at its heart, it's asking about what's the best way to be an ally to the community. I would say first that being an ally is more than having sympathy. It is more than simply believing in equity. That is going to take action. So I would say first, you need to do your research. Don't expect to be taught by your friends and your peers at work about what's happening. So learn the history, find out, what's been done, what's worked, what still needs to change. I know that our newsletter has been mentioned, and we are planning to include resources in the newsletter around readings and podcasts that are available. So keep your eye out for that. I think it's also really important to listen. That we as non-BIPOC community members need to learn to step back and hear what the community itself wants and needs. And this includes hearing critical feedback about our own actions, and that can be really hard. And so I think another really important piece is getting comfortable with being uncomfortable, that in order to be a really good ally, you are going to have to step outside of your own comfort zone. That means speaking up. So speaking up against racism, when you are, especially if you are in a setting where there are no, where you are surrounded by other white people, frankly, that it is your responsibility to step up and address racism in those situations. And I think, and also in situations where it's not safe for your friends and your coworkers to speak up. And at the same time, so the balance of this is also about learning how to amplify the voices, that it is not about us, that it is about us also making the space and stepping back. And And so sort of in the end, I would say, the last thing I would say is that it's also about showing up, that it's not just words, like it's not just speaking up, it's also about taking action and being present and supportive.
Thank you, Katie.
You're welcome.
And this next question, again, everyone, the questions are great. Keep them coming. You've all asked some really, really thoughtful, wonderful questions. And again, we're going to try and get to as many of them as we can. We're getting close to time, but I think we can still get a couple more. This next question is for Michelle. How can staff learn from others from different locations, programs, experiences, backgrounds? And also, is there work that was done prior in other programs that you can all kind of mention on?
Yeah, that's a great question. Thank you. I think as an agency, we have programs that are spread over a large geographic area, but we're all part of one big family. And lots of programs throughout the agency are involved in some really great work to address racial disparities. And so we have to create a platform where we can share that information and learn best practices. And some of the work that we've done in prevention really addresses disparities in the African American community. So one of the first things that we did was we joined a work group. And so we joined an LA County Eliminating Racial Disparity and Disproportionality work group that was part of the Department of Children and Family Services. It was a long time ago, it was back in 2008. And in that work group, we learned the data that identified that Black families are overrepresented in the Child Protective Services, they stay in too long, they have poor outcomes. And then we decided to launch a model to address that issue. So wherever you are, look at the data and see which group needs additional support. And in the cultural broker model, a cultural broker is a liaison between African American families in the community and Child Protective Services. They're an advocate. And we created a model around it. So there's training that goes with it, and there's kind of all of this work. And then we looked in our contract to see if there's ways that we can be intentional about infusing infusing a model to address racial justice. And so, for example, what we did is we had a contract that asked for case navigators, and everyone gets a case navigator. But we also designed a model where those who are African American got a case navigator cultural broker. So they got that extra support. It kind of goes along with what Vidka mentioned earlier about equity and equality. So equality is everyone gets a navigator, but equity is those African American families that need additional advocacy and additional support received a cultural broker navigator. And so I think we can all do this work exactly where we are, just looking at our programs. Another example is that our contract asked us to do evidence-based parenting classes. And we do evidence-based parenting classes, English and Spanish. We've done them in Mandarin and Korean, just based on our population we serve. We always made sure that one of our parenting classes was effective Black parenting, just to make sure that those families who are African American can meet with other African American parents and learn and support each other, learn from and support each other. So I think it's an important question. I think we're all doing really great work. And I think that we can be really intentional about looking at the work that we're doing and see how we can address racial disparity in the work that we're doing right now, just kind of right where you are and right in the programs that you are participating in.
Thank you so much, Michelle. I know that we're getting really close to time. You all have asked some really wonderful and terrific questions. I don't think that we're going to have enough time to do any more questions, but again, anybody that we didn't get to, we are going to put out some more information and try and get to all your questions in a written format if we can't do it verbally. But I just want to thank everybody for their time today. We really appreciate you attending. Thank you to all the panelists and the iDARE Steering Committee for your thoughtful responses and your participation. This is a really, really exciting development for the organization, and we can't really wait to get this work started and for all of us to get involved in this. So thank you, everyone. Have a good rest of your day. And again, thanks for joining us.
Thanks, everybody.
Thank you.